This is Frank Islam, Chairman and CEO of FY Investment Group, and your host of Washington Calling, where we interview leading voices from business, from politics that impact you, the viewer. Today, we are fortunate to have a special guest. His name is Dr. Majeed. He's a highly successful businessman who started Sabinsa Corporation, a pharmaceutical marketing company in New Jersey, and later Sami Labs in Bangalore. After COVID-19 started, his products have been in big demand around the world. He has received many awards, including the Ellis Allen Medal of Honor. So thank you, Dr. Majeed, for coming to our show. We greatly appreciate it. Thank you very much.
Thank you for having me.
So I will start out asking you a question with regard to telling our global audience a little about yourself, who you are, your wonderful journey, your story, your struggle, your sacrifice that you have encountered in making your company so successful. Just like my journey has not been a straight line. It has its own twists and turns. But
Yes.
what prevailed me in my journey to believe in America and American dream. So tell us a little bit about yourself.
Now, I am basically born and brought up in Kerala, south side of India. And in 1975, after my degree in pharmacy, I migrated to US. And there I worked in pharmaceutical companies like Pfizer and Carter Wallace. While I was working, I was also studying for my master's at Long Island University and PhD at St. John's University in New York. I finished all that in 86. I worked until 1988. Then I decided to get into business. I tried my luck because I was at that time interested in generic drugs, but I was way ahead of my time. So in the first 6 months itself, my well laid out business plan, I have to throw it out.
Okay.
And then I started looking at what best I can do. Then I realized India is very rich in natural resources.
Mm-hmm.
And it is not marketed properly in the US. In fact, it was not marketed at all at that time. So I looked into that opportunity. It was an opportunity that was looking for somebody like me, because Ayurveda, the ancient system of India, has a lot of good medicines. And they are not clinically tested or proven to the rest of the world. So therein lied my opportunity. So I started looking at that one. And my first product is a product I licensed from a pharmaceutical company in India called the Gugu Lipid.
What's
An
it
excellent
called?
product. Gugu Lipid.
Okay.
And it was for cholesterol reduction.
Okay.
And it has all the signs that I was looking for: safety, toxicity, clinical efficacy. So even though it is a natural plant material, when you put safety first, Americans look at you. When you say it is clinically effective, they have an interest. And most importantly, when you say it is a natural product, they are sold on that idea.
Okay.
So these were the elements I combined.
Okay.
First and foremost, it is safe. Second, it is clinically effective. Third and most important, it's a natural product. And that is what laid the foundation for my natural product business.
Okay, wonderful. So you're an entrepreneur, you're a businessman. Tell me, is entrepreneurs are made or born? Or both?
Actually, it is made. It is made, in my opinion. Okay. You know, there are so many brilliant scientists, they dream about this one, but unless they work at it, unless they believe, risk must be taken.
That's it. Okay. Very well said.
Otherwise, you will not find, what you are really good at it.
So you were willing to take the risk and venture into the new horizon, experiment new environment, and become successful. You know, I had a similar kind of what I consider a life journey that I went through when I started the business, and I sold it to Ross Perot in 2007. But I did not start in 1988. I started in 1990 2006 and sold it in 2007. So it was a good, it was a good, it was good. It was
Good run. Good
yeah,
run.
it was a good run. That's a good way to put it.
Yeah.
Would you be kind enough to tell our audience the role that your company is playing in meeting the COVID-19 challenge? As I understand your foundation, and tell me a little bit about that, contributed a significant amount of money to combat COVID in India, close to several $1 million.
Yeah.
And tell me the name of your foundation and what the foundation's focus are.
I'll come to that. But first, let me answer you the COVID-19 crisis.
Sure.
As soon as it happened, it came out as a bolt from, as a surprise for everybody. All on a sudden, the world woke up to a reality. There is an infection that you can get it, and you have to wear a mask. You have to use social distancing and sanitizer use. It came as a total surprise to the whole world. And one of the products that I have been marketing for years, curcumin, that is taken from turmeric.
Turmeric.
In 2020, May, me along with a few other scientists across the globe published a paper. If you take curcumin, you will be more or less safe.
Very good.
Then at the same time, we did a study on selenium in India, the level of selenium in South India specifically. We found the selenium level in India is low among the Indians. And if your selenium level is low, you could easily get COVID-19. And, I have about 1,500 people in India. So one of the things a lot of people. One of the things I did was I put together a combination of herbal extracts and minerals into a formulation, called it immunoactive. And I asked all my people, take these capsules once or twice every day. It contained curcumin. It contains a herbal item called Andrographis paniculata, zinc, selenium, and my classical material for increasing the bioavailability, bioperin. So it is an antiviral formulation that we made, given to all of our products. We have, among the 1,500 people, we have extremely few incidents of COVID and no casualties or no fatalities among our people.
Wonderful. Now, you live in America, so tell us a little bit to the people over here in our audience, share your experience. How is the American ingenuity, experience, innovation help you to make your company a leader? And also tell us a little bit about shine a bright light on where your main markets are. And do you believe that the American experience living in America made you who you are today in terms of your success?
Actually, I tell a lot of my people, send a boy to America and get a man back.
Well, that's a good way to put it. Very well said.
Yes. So when I landed in the US, I was naive, but I had one advantage. I could speak. I could stand up and speak English with no hesitation.
Right.
So I learned a lot. Studying, at the same time working. Nowhere else in the world you can do that.
Correct.
Only in America. Okay. And in my case, Pfizer picked up my tuition bill also. Okay. That was an added plus.
That they paid you for education.
Yes. And the experience I had in the United States was amazing. Amazing. Like I said, they made a man out of Majeed. And I learned quite a bit.
Yes.
I had worked for some of the great people in the pharmaceutical industry who worked for Pfizer and Carter Wallace. And every day was a day I learned things. I really look at that way every day. From a scientific point of view, from a personal point of view, I grew. Okay. Even when I made the decision to go into business, and when most of my friends advised me against that one. My own mind told me, you must take this chance. If you don't take this chance, you would never know whether you are good at that one.
Right.
Now, that is the American spirit in me
That is
talking.
the America's ingenuity. This is America's
Exactly.
creativity. This is who the
Yes.
America are. And that's what made America a shining city upon the hill. As John Winthrop
Absolutely.
said in
Absolutely.
1636 on the ship Arabella. So this
Yeah.
is who we are as an American.
Yes.
Wonderful.
Yes.
I want to talk a little bit about, you have diversified into marketing Indian spices.
Yes.
Please tell us the medical and nutritional benefits associated with Indian spices. I want you to talk about the health benefits of cloves, cinnamon, cumin, cardamom, nutmeg, turmeric, and also black peppers and ginger. Those are
Okay.
and my wife's asked you to ask you about turmeric because she takes the turmeric and she's an American woman, but she believes in the spices. So tell us a little bit, shed some light on these things.
Let's start with turmeric.
Turmeric, wow.
Turmeric contains curcuminoids. It's not one curcumin, it has 3 components in that one. These curcuminoids are very powerful anti-inflammatory agents. You see, every disease has its origin in inflammation. If we can manage inflammation, we can manage a lot of diseases. If we can manage inflammation, we live longer, healthier. So your wife is doing the right thing. She's taking the right product.
Right.
So I had the original patent on curcumin in the US, which was never contested by anybody. Then let me take you to black pepper also. It's an amazing product.
Yes.
See, Frank, you are taking vitamin C, for assuming you are taking vitamin C. You think you are getting 100 milligram vitamin C when you pop 100 milligram tablets into your mouth. In fact, you are getting about 20 milligram vitamin C absorbed. But if you take it with a little bit of black pepper extract called biopirin or piperin, instead of 20 milligram absorption, you will get about 70 to 80 milligram absorbed into your body.
Wow.
Now, a little bit of this black pepper extract makes that difference. That was also patented by me because that's a new idea, which I proved in clinical trials in New York. I think I did the studies in Majeed Medical Center in New York. So there is curcumin, there is black pepper. Same with the ginger, very powerful anti-inflammatory. In fact, if you look at general reviews, both curcumin and black pepper extract is all used with the trade name biopirin. Ginger is also used as an anti-inflammatory agent by many people. Okay, I'm not going into many of these items. Before I introduced turmeric, curcumin as an antioxidant phytonutrient, it was used by Americans for cheese coloring.
Yes.
So I brought in a paradigm shift saying that this is, you can eat as a tablet and it is good for you.
And that's what she does, my wife does.
Yes, and I wrote the first book in 1993, second book in 2015, a third book in 2018. The third and the last book talks about what happens to curcuminoids in the body. You know, when you take the yellow turmeric, it becomes white in your body. It's an amazing thing what happens to you. And
so what you're saying, there are a lot of benefit associated with the taking Indian spices in terms of healing, in terms of many, you mentioned also I think one of the cancer, you can also get rid of that because of taking the turmeric also. It's a wonderful, and now we have to make sure that people in the Western country realize and understand the potential of the Indian spices and how it tastes good and also is good for your health.
Absolutely. And I think the Western world now understands it.
Yes, they do.
Yeah. What I have been selling in small quantities, now I sell in 500 tons, 600 tons quantities.
But
And
remember,
today,
Columbus wanted to go to India to get the spices,
yes.
but he ended up in Caribbean and North America. So, and I believe the Portuguese were there before the before the Dutch were there, and
Yes.
English there in India,
Yes.
because they were in the Goa, I believe.
Yeah.
And you probably know the potatoes came from Peru, and the Spaniard brought that to all over, Europe and Asia. Right?
Yes. Yes.
I know your company has and you mentioned that, during our conversation, many scientists who's conducting research in the United States. And how do you get those pools of the people who have the skills, abilities, experience, and expertise? And where do you get them from?
India, all said and done, is a highly educated place. And a lot of these Indians go to US, Europe, and other places and get skilled in their respective areas. So I collected a lot of these people who have good experience in the US, Europe, and I put them together. In fact, I started my R&D center in Princeton, New Jersey. Yeah.
Right. Not
And
too
then
far
I
from my
realized-
house. I
Yeah.
live in Washington, D.C.
Yeah. Then I realized that I could employ more people in India and get a lot more done in India
Okay.
at a much better price. So I consolidated my R&D base in India because a lot of good educated people are available here in India.
What kind of skills do you need? And I want you to connect you with the people from Aligarh Muslim University so you can hire them. What kind of people you're looking for, Dr. Majeed?
I look for people with good or excellent phytochemistry experience, people with a good microbiology background, biology, people with excellent synthetic chemistry background.
Okay. And I would love you to connect with some of the people, the Vice Chancellor of the AMU, when you send the email, so that hire some of those people who are very bright and they're looking for opportunity to serve and work with you.
Will be my pleasure.
So we will connect, inshallah.
Absolutely. Absolutely.
Talk a little bit about the Dr. Majeed, the growth and the development in coming years and in the decades, as a matter of fact, of the evidence-based natural product. That's what you are good, and this is what you have done. That's what you're doing. Do you think there's a market there? There's a growth there, and people are going to buy this thing, and you're going to make your company bigger and brighter and better?
Absolutely. I always think we just touch the tip of the iceberg, because there are a lot more natural products that are very useful that are still not researched like we do. And they are all, that work is going on in the background. I'm sure you noted and you asked a question about my patents, 292.
292 international patents.
Yes.
And
yes.
This is a phenomenal achievement. Tell us, during this conversation, you need to shed some light on this also, on the patents.
Yes, because today in this modern world, unless you can patent, you will perish. Okay? Because your competition will come in and sell it at a very cheap price. It is not only the 292, I have 300 in the pipeline. It's still pending. Pending. And all the 120 scientists I have, we are still working on innovative ideas. It is not only on natural products, we are working on innovative ideas in probiotics, that's using microbiology, fermentation technology. Okay. And we are very strong in synthetic chemistry.
Okay. Synthetic chemistry. Okay.
Yes.
Wonderful.
Remember, I was talking to you about the role of selenium.
Right.
Your body has 98.75 microgram of selenium in the body, microgram per liter in the body. You will never get COVID. that data has been published. And I did a study here showing in South India, people with the low levels of selenium get COVID faster. So it's coming out. Some of these products have a role to play.
It does have a role to play. I agree with you.
Yeah.
Well, I want to express my deep gratitude for your leadership, for making a meaningful and profound difference in people's life and their health. And thank you for coming to our show. This is Frank Islam wishing you a great week.